The vagus nerve for hypnotists. If you want to do hypnosis or use hypnosis to help clients dealing with physical symptoms and issues, you want to have a very basic understanding of the vagus nerve. That is kind of our playground, so to speak, when it comes to helping people get their body into a state where natural healing can occur. Now, if you're new here, my name is Penny Chiasson. I'm a board certified hypnotist and a certified professional hypnosis instructor, but have 25 years in healthcare. And 15 of those years was as a nurse anesthetist. And I spent 27 months of my life training to understand the vagus nerve, the sympathetic nervous system, and how it interacts with the body's entire stress response so that every single patient who ever came into my care for anything from sedation to open heart surgery, I understood how my medications and how their diseases would all interplay together in this parasympathetic sympathetic nervous system balance. That is how your nurse anesthetist, your certified anesthesiology assistants, and anesthesiologists keep people's behinds alive. All the doctor does what it is that they are doing. So let's just begin by talking about why the vagus nerve is important. The vagus nerve is the single nerve that is responsible for rest, relaxation, and healing in the body. The single nerve, it is the longest nerve. And it's called the vagus nerve because it's nicknamed the wanderer, because it innervates everything from the way our pupils dilate to our vocal cords to slowing our heart rate down to our sexual function. That nerve goes everywhere and it impacts everything. So the vagus nerve is also called cranial nerve 10. And what it does is it allows our body to go into rest and relaxation mode. And I'm going to break down here for you why it's important to understand this, because you need to have at least a basic working knowledge when you're working with clients who are dealing with health-related issues, because some of the things that are important to work on, they may not have made that connection, or they may have been so gaslit by their physicians, their care providers. Maybe they're one of those difficult cases and nobody has been able to figure the issue out yet. They have years of frustration behind them. So it's important to understand how all this comes together, because you want the client's buy-in when you are addressing these issues. So the vagus nerve is the parasympathetic nervous system, or the PNS. Then you've got the sympathetic nervous system. We all know this is fight or flight, but that doesn't mean the sympathetic nervous system is bad. It's what keeps us alive when we get into an accident. It's what keeps us alive when we have a cut so that we don't bleed to death, things like that. So the sympathetic, and we call this the SNS, and we know it as fight or flight. Short-term activation of fight or flight is a good thing. It's a good thing. Short-term activation is good. That's the way it was meant to work. In the world of survive or thrive, we are meant to learn, we are meant to live in a thrive state. That's how we're supposed to live, in a thrive state, with this only kicking in once in a while. And through this series of videos, I'm going to share with you how the state of the way we just live our life in general these days keeps us mostly here instead of here. That's why we're seeing so much illness, sickness, and disease that people have. But your vagus nerve begins in the brain, and it comes down and it spreads out all over the body. These nerves, there's a nerve track that goes down through the spinal column, and then it's called the sympathetic trunk is the technical name for it. It's a bundle of sympathetic nerves that sit right in front of the spinal column. and they're in the chest area. I'm not going to get too technical with you here. And those nerves spread out everywhere to give that other balance. And one of the things that they connect to is they connect to the adrenal glands. Now, they also regulate blood flow to your circulatory system, so it constricts blood vessels. This includes to your gut, your liver, your kidneys, your lungs. Okay, so a lot of things are happening and going on here with that sympathetic nervous system. So let's just go down a list here, shall we? So we've got constricts blood vessels, except the blood vessels that go to the lungs and large muscle groups and to our brain, because we might need to run from that bear in the woods. But it will constrict blood vessels to a lot of different areas of the body. It's going to slow digestion. It is going to slow urinary excretion by relaxing the bladder. If you've ever been really stressed out, or maybe you had to speak on stage, and as soon as you were finished speaking on stage and you relaxed, all of a sudden you had to go to the bathroom to empty your bladder, that's why. During that time, it relaxed your bladder, but your bladder filled up. And then when you're off stage and that vagus nerve kicks in, it's like, oh, I need to run to the ladies' room or to the men's room. Your pupils are going to dilate. That's so you can see danger. When you're in a stress response, your pupils are going to dilate way out. Your salivation is going to go down, right? Slow digestion, decreased salivation. Your liver, it's going to increase liver production of glucose. Everybody thinks of insulin when they think of blood sugar, but your liver is in control of what happens with sugar that goes into your bloodstream. Either it gets converted and stored as fat, it gets stored as glycogen, or protein and convert it into glucose for our body to use for energy. So your liver is going to increase glucose production in all of that. And as you can imagine, if you're pretty stressed out, you're not too interested in sex and those kinds of things. The vagus nerve, our pupils are going to be constricted. When we're really relaxed, we got constricted pupils. We salivate. We can tear up. We make tears, lacrimation. I didn't put this over here. Decreased tears. Okay. We have digestion. This is going to become important in one of the later videos, because clients can confuse relaxation with the body not wanting to digest, and that's incorrect. It's actually right the opposite. So digestion, sex, orgasm, and you have your increased bladder tone, increase urination, increase defecation. Okay, so these are some of the basics. Now, anytime we go into a temporary stress response, some other things are going to happen in order for us to survive. We're going to have increased blood clotting factors, and our immune system is stimulated. Think about somebody who has a cut. We want the immune system stimulated so that the body can immediately go to work to prevent infection. This constricting of the blood vessels, we see increased heart rate, increased blood pressure. When this goes to the adrenal glands, the sympathetic nervous system, people think adrenal glands, they automatically think cortisol. That is true, but when the sympathetic nervous system goes to the adrenal glands, what it causes is for the body to dump increased adrenaline and noradrenaline. come from the adrenal glands as well, just not those hormones like cortisol. So when we can help someone with hypnosis, we can tip the scale into the favor of parasympathetic nervous system. How does that happen? It happens through a higher level activation. Stay with me here. Those of you in the alumni group, your handouts are going to be below this video. And for anybody wondering what the alumni group is, all of the students who go through the Elite Hypno Pro certification training will get access to these videos. Not only do they get access to the videos, they'll get access to handouts and suggestions that they can use when they are doing script-based work for healthcare conditions. You hear me say a lot of times, I don't do script-based work. Well, that's what I'm dealing with, the mental, emotional stuff. When it comes to different symptoms, physical symptoms people may deal with, suggestions become appropriate. So within the brain, we have what's called the limbic system. And that's old terminology. It's really not a system. It's a collection of different brain structures. And there's just an orchestration of data that results in an output. It's like having several, in this day and age of AI, it's like having several AI agents working together to write a blog post. One is writing your headline, one is writing your hook, one is doing your SEO, and one's actually writing your content to sound like you. So any signals that come in through the body, they come up through the thalamus. All of the sensory information that we receive, and sensory information isn't just sight, sound, touch. It's sensory from inside the body. Is your stomach distended, right? Is there something going on inside the body? All of this information is coming in. It comes to the thalamus. The thalamus shoots the information out. It's the air traffic controller. But within the limbic system, we have the amygdala, where it will take the data that's coming in and it'll say, am I safe and secure or am I not? That's its sole job. Do I need to be in survival mode or can I be in relaxation mood? Can I be in thrive mode or do I have to be in survival mode? Now, if the amygdala decides that something is a threat, it is going to activate the AEA axis. And I could really get into the nitty gritty of this, but I'm not. This isn't a full physiology lesson, but it's the hypopituitary adrenal axis. This is how we get stimulation of the adrenal gland, where this pituitary gland is going to release a hormone, ACTH. This is pituitary. And then that is going to tell the adrenal to release the cortisol. And in a later video, I will break down for you what happens with chronically elevated cortisol. But cortisol also causes our blood sugar to go up. Temporary in low doses, it helps immunity, but chronically, it's bad for our immune system. And it's bad for our blood sugar. So we will get into all of that later. But the amygdala is influenced in hypnosis. The hippocampus, which is involved in our memories and our replaying of events, like when we pull up things that have happened, we're playing through events. The hippocampus comes up, the hippocampus feeds into the amygdala. We have other areas of the brain. We have anticipatory states. We're trying to predict the future, what's going to happen next. All of these things come together to create a mental, emotional component of stress activation. So I will do a video that focuses on nothing but things that activate the stress response and throw us out of balance with the parasympathetic nervous system, so that you know the different areas that you can do hypnosis with a client and you can help them. But the hippocampus, the amygdala, the anterior cingulate gyrus, the default mode network, all of these things are active when someone is in a hypnotic state. And when someone's in a hypnotic state, if they actually relax and they go into alpha and to theta, they shut this off in most cases. And we'll break that down later. Please be sure to like this video, leave a comment, ask your question for the coming videos, and subscribe. And by all means, if you enjoyed this video, share it with friends.